It seems as if every day we are hearing about another bill either being written or passed by state legislators where it restricts or makes illegal for people to get gender affirming care for people who do not believe that the sex that they were assigned at birth represents who they are. Let's talk about it. Hey everybody, it's Dr. David. So I want to premise this that as a pediatrician, I work with people from a wide variety of families. People have different religions, different walks of life, different socioeconomic backgrounds, etc. And one of the things that comes up now and then is that no matter what their background, some of the youth that I take care of are having issues with their gender identity because what they are being told as to how they can live their life is not matching who they feel that they are. Okay, now some are really struggling. Some are really confused. Some are having significant mental health issues over this. And I mean, again, I want to emphasize that a lot of times I am even the first person that a youth may bring this up to. They may be afraid to talk to their friends about it. They may be afraid to talk to their family about it, especially if they think that their parents will not agree and will not support their decision. So I am here on the front line. Now, it is my responsibility to care for every individual, both in terms of their physical well-being as well as their mental health being. That's the only skin I have in this game. And if people feel that they are not being properly treated, and especially if they're having significant mental health consequences before that, I need to step in. Okay, now I also see how frustrating it is for the youth when they're not feeling like they're listened by even other people like their doctors or their schools, etc. Sometimes they just want to be heard. Sometimes they just want to point out that they recognize that they're different and they want to make a difference about this. So now, when these types of laws are being passed, it makes it more difficult for these children to come out and to talk about who they are and how it's bothering them. They are afraid because of this. What's going to happen to them? What consequences are going to happen to them? Are they breaking a law themselves by wanting to do this? And we are seeing in some states where people wish to have their pronouns be respected as to who they feel they are. That's being made potentially illegal too. So, anyways, I just question that if, especially, I know that some of the families that are having the biggest challenges with this are people who come from conservative religious backgrounds. Okay. And I know that one of the things that is so professed in such backgrounds and such families is family values. And I just fail to understand how not doing things that would support the well-being of a child is congruous with family values. Okay. Now, just as I have a strong interest in supporting the rights of people in terms of how they choose to vaccinate, how they choose to educate their children, how they choose to feed their children and themselves, of course, how they have autonomy over their own religious, over their own reproductive rights for women and what happens to their own bodies. This is another area where I am standing up for the rights of the individual to express their medical freedom. Okay. Now, the challenge that I'm also seeing here is that a lot of these anti-trans bills, they're really targeting marginalized populations that really don't have much of a voice, that don't have a lot of people that stand up for them. And of course, what that does is it drives them even further into problems. And we did see this a generation ago with the AIDS epidemic. Now, back then, it was assumed that this was a gay disease, which, of course, we now know it is not. It just grew with first in the AIDS gay population because they were the people who were having intercourse with people. But we now know that it is an absolute that it is a heterosexual disease, not just a homosexual disease. But yet they were stigmatized. They weren't given the proper health care that they needed. Many people, it was way too late before they could even get to see somebody, and that brought profound consequences. And if you look at how many people have died during especially the height of the AIDS epidemic. Now, I want to go over some definitions here before I go forward, and I also do want to refer you to the ABCs of LGBTQ video that I did about a year ago. You'll find it on our YouTube channel if you really want to get into some of the definitions relative to all things related to this population, to this community. But I'm only going to focus on a couple right now. Okay, number one, transgender. Let's talk about that. Okay, what this means is that a person does not associate with the sex the gender that they were assigned at birth, that they feel that the body that they are living in, that what they're seeing in the mirror does not comport with who they are. Okay. Now, what is gender identity? It's one's psychological sense of who their gender is. Okay. So if somebody says, I know I'm in its male body, but I feel like a female, that has to do with their gender identity, is how they are wishing to identify. Okay. Now, about 2% of high school students identify this way as transgender, 1 in 50 people. It's a small number, but it's not a nothing number. Now, one more definition, which is gender dysphoria. And this is when a person, because develops significant psychological stress from an incongruence, from an imbalance between who they are told they are, or what was assigned to them, and who they feel they are. Now, there are some people who are transgender who are perfectly comfortable in their own skin and very comfortable with who they are, but not all people do, especially when they see the way that society is treating them. Okay, but I do question, because approximately 25 to 30% of transgendered youth in our country have tried to kill themselves. They tried to commit suicide. Again, I question in the name of family values. And also just because a lot of people who are arguing against transgender care say that they're doing it to protect the children. And I have a really simple question for you. How is a child who wishes to kill themselves or may be successful protecting the children? I don't see how it happens. You may have your own thoughts about that. Share that in the comments, but I don't see how that happens. Okay, now, despite that this is a disease that can lead to death, shouldn't that be something that we are trying to support to help this person not take those types of measures if that's 25 to 30%? Okay, so now what I want to talk more about are the types of transgender healthcare that is available to people. Okay, and especially to the youth, because of course that's where it's most commonly hitting them. Okay, now one of them is just referred to just social transition. Okay, this is where people just feel because they do not feel like their body matches who they are told they are, that sometimes they just want to be called a name that's more fitting to who they feel they are. They may change their name. They may want to be called somewhere. They may just decide, hey, I don't like it if you call me him if I feel like a her. Can you call me a her? And I would pose to anybody who has a problem with that, why is that a problem for you? Right? How is that hurting you or your family or your community or your society in any way by respecting somebody's request? Because that's all it is. It's a request. Okay? Now, some of them will also, maybe they'll wear clothes that matches who more their identity is. Or they may want to use a bathroom that matches their gender identity. Now, I do want to put some significant praise to Republican Governor Youngkin of Virginia, who just this past week called for non-gender bathrooms in order to accommodate people who feel that they don't associate with one gender or another, or if they feel that they can at least feel comfortable going into this. So he's saying that schools should allow and should have more of these types of restrooms available in order to make people who are in the transgender community feel more comfortable. Good on you. Thank you for that. Hopefully your state will follow through with it, and hopefully other states will as well. Okay, now the next step that some people will then go to, and some people only need step 1, and that will make them satisfied. Okay, now step 2 is medical intervention. Okay, now of course there's psychotherapy, people helping themselves mentally, working with therapists, potentially if you have depression, to help them better work through who they are and how they can come resolution to that. Okay, but there are also medications called puberty blockers. Okay, and these are called gonadotropin releasing hormone, and they're agonists. And what they do, so in order for puberty to kick in, this hormone called GnRH needs to be released by the brain in this pulsatile type of manner. And what a lot of these medicines do is they stop the pulsing. It's more of just a continuous exposure, and that's what stops the onset of puberty. Okay, now, first of all, young children are not given this medicine. Okay, it's only once puberty starts. Now, these medicines also, they do not bring permanent changes. And in fact, if those medicines are stopped, puberty is going to then, the pulsing will start and puberty will proceed. So this is actually something that is reversible. Now, unless they then start what are called hormone therapies. Okay. And basically, if there is a person who was assigned male at birth, but they're associating and feel that they are a female, then they would be given more estrogen types of hormones in order to allow that to happen and for them to develop that way. And of course, on the opposite, if there is a sex assigned at birth female who feels, no, I really am a female more in a male body, a male in a female body, they would take testosterone in order to again bring that around to more what they are associating with. Okay, now as far as the there's then these hormone therapies, and of course, the earlier that any of this is started, the better the outcome cosmetically looks. Of course, if somebody feels that they are a female, or if somebody feels they are a male, they kind of want to look that way, right? It would only make sense that that's what they want to do, right? Just like if a person who has genetically short stature, such as myself, I was given the opportunity to start growth hormone in order to make myself taller because I was not so psyched about the fact that everybody was taller than me when I was younger. I ended up deciding not to do that with my family simply because of the fact that I was told that while I may grow faster at that point, that at the end, the cosmetic outcome, the growth outcome, actually could have been stunted, and I may have ended up even shorter than what I would have naturally come up to be. And so I decided, and my family decided, not to go through with that therapy. But it's kind of another example of how a hormone is given to somebody in order to change their physical outcome. Yeah, right? So anyways, in addition to that, the other types of medical intervention is that some people will undergo voice therapy. Not surgical changes, but they may decide, hey, I wish I could talk with a lower voice, and so I'm going to start doing therapy to give my voice a lower up here so that I can speak more naturally in this way. Or they may decide they want to speak a little higher, and they're going to do therapies to keep their voice up higher that may comport again more to their sexual identity. All right. Now, on a whole, nationwide, 3,000 to 4,000 youth will undergo some form of medical treatment, such as what I just described. Now, in addition to that, there of course are surgical procedures, and what this allows is for people to take on again the physicalness that allows them to be who they identify with. There are facial reconstructive surgeries, maybe about an Adam's apple or bone structure in the face. They may have chest therapy, where they want to make smaller their breasts, especially if they are a genetic female who wishes to be associated with a boy. And then there is, of course, what's called bottom therapy or genital therapy, where there are procedures that are done in order to make them look that way more naturally down below. Okay, now, first of all, 75% of people who identify as transgender do not undergo surgery. It's a minority of people who choose to do that, okay? Secondly, this is not something that is done to children, okay? It's not done. This is something that is exclusively reserved for older adolescents and possibly even just for adults, okay? Now, there has been this avalanche of laws that are being passed around the country, and those trying to ban this type of affirmative care. Now, I feel, and it's my opinion, we're all entitled to an opinion, that this is really not based upon any science. Because if you looked at the science is as much about the psychology and what this is doing to people when they're not allowed to look and to feel the way that they feel inside. Okay? Now, in my opinion, this is, their conclusions of people who wish to ban this are often based upon things like fear, ignorance of just not understanding it, but there is also hatred, bigotry, and fear-mongering going out there. And this is an area where I do want to call Florida's Governor DeSantis out. Okay, because he recently said about as part of this, he said regarding people who are promoting gender affirmative surgeries or care, and they are literally chopping off the private parts of young kids. They want to castrate these young boys. You don't disfigure 10, 12, 13-year-old kids based on gender dysphoria. Now, he is right about one thing. Nobody is doing that. There is no one legally disfigures a 10 to 13-year-old child, okay? There are no credible reports of this happening. In fact, when media asked him Can your office please provide some reports? What are you talking about? And the reports that to back him up was actually of one child who was 15 years old and one child who was 17 years old. These were not young children. These were not 10 to 13-year-old boys. They were not being castrated. There's no evidence of that. Again, if anybody has something that says the difference, post it online. Let me see some critical medical research, data, reports that says that this is true. Okay? From what I understand, it's not. Okay? Now, it is very unlikely that any type of gender reaffirmation surgery, as I said, is done in any type of minor whatsoever. Usually the types of gender affirming care is just, it gives them the opportunity that if they wish to make a change in the future surgically, that they can. That's where the puberty blockers can come in. So that at least if they don't know what they want to do, that they at least have the opportunity to later on. Okay, so now, those who are opposed to gender affirming care, I just ask you some simple questions, okay? How is the decision of an individual and their family who chooses to go forward in any of these types of directions impacting you, your family, your community in any way, shape, or form? How is that medical liberty if you're wishing to suppress somebody else's choice? Is this hampering your life in some kind of way? If it is, again, let me understand how that is, because I am not seeing it. Okay? Now, are you not enjoying joy? Are you not maximizing your life potential because of somebody else's decision that really has nothing to do with you whatsoever? Again, I don't get it. I would love to understand where the people are coming from who are opposing this, because as far as I can tell, this is just something that has to do with control. And because a person doesn't like it, they're not going to let it happen to other people. Anyways, I know that was one of my longer videos, but it was an important topic that I felt really I needed to do justice to. So thank you for listening. Please share this information. Again, please comment. Keep it kind. We will not put up with vile comments in our in our videos and in the comment section. But again, this is part of having conversation as an open society for people to better understand where people are coming from. Have a nice day.